We're going to wait just about another minute or two before we get started, as I know that some people maybe are trying to figure out how to log on here. Hey, I think we will get started. I think it looks like some people enter and then exit, so hopefully everyone's able to get on here. And yeah, if anybody trickles in, that's okay. Um, my name's Amy Keller. I'm a physical therapist. We're going to get kind of into our intros, but I'm going to go ahead and share my screen. So I won't be able to see if anyone asks anything in the chat. And that's another thing too. There's an icon at the top that if you click, it's the first one, at least on my screen, that chat button. So if you guys have any questions or anything as we go, you can type your questions in there and we can see them and answer them. And you'll always be welcome to just pop on and ask via your voice too. But if you don't want to do that, if you don't want to talk at all, if you don't want to show your video at all, that's totally fine. Yeah, you can use that chat option. And yeah, our other providers will be looking at that because I won't be able to see it. So I'm going to go ahead and share my screen here. Attempt to. Okay. All right. So what today is we don't really have any specific content planned, but it was just a time for us to kind of let you know what we do, things that we treat, and then just, yeah, open for any and all questions that you have about pelvic health. So we'll start with some intros about us as providers, and then we'll go into kind of some conditions that we treat, just some frequently asked questions, and then we're opening it up to your questions. We had some people submit some ahead of time, so we'll go ahead and answer those. But sometimes those help trigger other questions, so feel free to just kind of ask away as we go. And yeah, so we'll go ahead and get started with our intros.
Hey, so I'm Carol Kelderman. A little bit about me. My journey with pelvic health started about 28 years ago. I went to the University of Iowa, did my undergrad, and then I went to Creighton University for my doctoral studies. And while I was there, took some of the classes that were foundational for what has become pelvic health. It used to be women's health, but now we know there's a whole lot more out there than kind of the basic things. And so I have three children. They're grown. I actually have a daughter-in-law and a son-in-law now, and so I've been incredibly blessed to have these women join Kinetic Edge and be part of the pelvic health team. They do an amazing job. And the reason that I love working in this space is because it's a little bit underserved. It's starting to become better served, but it's amazing how much hope we can bring to people who are kind of suffering in silence a lot of times. So that's kind of my why.
And then, yeah, I'm Amy Keller, one of the physical therapists. So you already saw me, and you'll maybe see me a little bit later, but that's my picture, an old picture that I need to update. I work at our Ames West location, and Carol is at our Oskaloosa location. She didn't mention that, but it's on there. And I went to Des Moines University for my PT degree, and I've been practicing with Connecticut Edge ever since. And I've been doing pelvic health for the past probably almost 4 years, I think. And I have two little boys, almost four, and a 2 year old, so they keep me busy. And yeah, I've really enjoyed treating this pelvic health population. It's like Carol said, they're kind of suffering in silence. It's stuff that nobody really wants to talk about. So it's like so relieving for some people to just be have someone to talk about with, and find some answers and some hope for them, and just get them back to feeling like normal and they can do their normal things. So.
All right, I am Katie Hall. I'm also a physical therapist. I work out of the Des Moines Clinic, and like Amy, I went to Des Moines University. I've been with Kinetic Edge for 8 years, but I've been practicing for a little bit longer than that. And I think I'm 3 years into treating pelvic health conditions. It wasn't initially an interest in mine, but I love working with kind of complex hips. And then I had a complicated twin pregnancy. I now have a boy and a girl. They're 6.5 years old, and I've had my own kind of pelvic injuries and things like that that just made it a natural path. The more I learned and the more I personally experienced, the more I realized for me to continue doing what I want to do with the populations I want to treat, this is where I need to go. And it's unlocked a lot of doors for me and really, I don't know, it's been really fulfilling for me. I think really fulfilling for some of my clients where maybe I was missing some marks before.
Hi, I'm Rachel. My last name is going to be changing in a little bit. I just got married about a month ago, so there'll be a different last name that you'll see associated with that picture coming up. But I'm at the Oskaloosa location. I went to Creighton University for my PT degree and got interested in pelvic health at school and kind of took the women's health tracked in PT school and got it started there in around like 2022 and graduated in 2023. And I've been kind of dabbling in this population when I was a new grad and still a newish grad, but continuing to like further my learning in this population. And I really do enjoy it, kind of giving people like that's been echo throughout New Hope in this silence that it has so much kind of stigma to it with some of the issues that we deal with and help with. And I'm just kind of starting to end that stigma a little bit and make it a little bit more open of a conversation and more normalized throughout society too. So it's something like I've become very passionate about and love serving.
Hi, I'm Emma McCauley. I have been a PT with Kinetic Edge for about 2 years now. I went to Des Moines University also for my degree. I've been officially treating pelvic floor for about 6 months. I'm at the Des Moines Clinic, and I think what initially got me really interested in this area was through just my time in PT school. I was able to observe on one of my clinicals just really how effective it is and how much it can change someone's life. When you have urinary, bowel dysfunction, sexual dysfunction, it really impacts your life. So, just wanting to help bring some improvement and increase in quality of life. So.
Hi, I'm Courtney. I am a physical therapist both for Newton and Oskaloosa. I graduated from Des Moines University last May, so about a year ago now. And I have been working at both clinics ever since. And I love that I can bring pelvic health to the Newton Clinic and serve my hometown population. So the thing that kind of got me started with pelvic health was the postpartum aspect, and how pregnancy is a huge change in our body we experience as women, and there's really no treatment or no regular like return to life protocol that you just get from your OB. You go to your 6 weeks and they're like, we'll see you later. But that's starting to change, so we love that. But also now that I've been treating it, I get to treat some other conditions, and kind of what they've said, just giving hope to people who just are not, they feel like it's something they have to deal with forever. So I'm glad that I can serve in that way.
So just a quick overview of some of the things that we treat. Some of the most common things, they're the things that would be most often associated with it would be some kind of a bladder dysfunction, urinary incontinence, whether it's urge related or maybe stress related, or when there's increased pressure is what we call stress incontinence. But sometimes it's just simply urgency, like I got to go really bad and I'm having a hard time with normal life type things, or frequency, I'm going really frequent, bedwetting. And then also bowel dysfunction, which isn't something that maybe some people realize is part of this space, but fecal incontinence, constipation, painful bowel movements. A lot of our patients will have the story where, you're talking to them about other things and then they're like, oh yeah, I've been constipated for, and so they don't even realize that when they come see us that we can kind of help unlock some of those things as well. Pelvic organ prolapse, prenatal, and like labor and delivery preparation. Also working with pregnant clients and postpartum. As most people realize, there's sometimes some pain, orthopedic type pain related to some of those type things, and some weaknesses that can develop. Something else that people don't always realize is the influence of the pelvic floor on intercourse, their ability to tolerate pelvic exams, maybe use tampons, those types of things. And that there's actually hope, that it's not something that they have to just live with, or just relax, whatever. Yeah, sometimes it's just general pelvic and abdominal pain. Was there a question? Okay. Sometimes just general pelvic or abdominal pain, and sometimes like back pain. I think Katie mentioned, occasionally we didn't realize with the hip pain or back pain, like there's actually some pelvic dysfunction, and unlocking those things can be huge for some of those clients as well. And then diastasis recti or core weakness. Don't think of the pelvic floor as core muscle, but it's absolutely core muscle, and we can go into a lot there, but and then male and pediatric bowel and bladder dysfunction, working in that space as well.
Okay, then just getting into just some of the frequently asked questions that we get from people. Do we accept all insurances? Yes, we do. Just call us and we'll check on what your benefits are. And kind of getting into the next question, do I need a referral? What's the cost? That's all going to depend on your insurance. So just call us and we can get your insurance info and we'll check. Typically, Medicare and Medicaid will require a referral from your doctor, but most of the others do not. And then cost, again, is just going to be in your insurance plan. Some people have a deductible, some people have a copay, some people have a co-insurance, some people have met all those things and don't owe anything. So that's all something that our insurance people can check for you. And then how long will I need to be seen for? Our appointments typically are 40 minutes. And then just depending what's going on, we usually see clients one time a week for 2 to 3 months is kind of what I plan on. And that obviously can change depending on how well you're doing, your schedule, stuff like that. But that's kind of a typical time frame. So
All right, so next question is kind of a big one. What type of treatment techniques do we use? This really depends on what our client specifically has going on with them and what our client's comfortable with. So something I was surprised about when I got into this is just the amount of education that we can provide about all kinds of things, from bladder irritants and toileting positions, pressure management, posture things for life in general, things that now that I'm raising little humans, we weren't taught necessarily the best way to go to the bathroom, but maybe we should do a better job going forward. Just little things like that that can be really kind of life changing. So lots of education. We do utilize manual techniques, so that's using our hands or maybe our hands assisted by devices to help loosen up muscles or get scars moving a little bit better. And that can be externally or internally, depending on the client's needs and comfort. And then we do, as physical therapists, I think it's well known that we prescribe exercises. So a lot of times that can be muscle strengthening, lengthening, or coordination. We hear a lot about Kegels, which are really kind of tightening, shortening, strengthening. But we see a lot of clients who have a really hard time actually relaxing and letting their pelvic floor lengthen, or they don't have good coordination of it. So when we need to be able to block flow of urine or do a lunge without having incontinence, then we need the right amount of muscles to kick in at the right time. So we spend a lot of time working on the right amount of activation or coordination. We also use devices like biofeedback and electrical stimulation just to help people kind of gain a better awareness of what's going on there and give the tissue some stimulation to bring some awareness. And then we do bladder and bowel retraining for people with frequency and urgency. This can really help get control of those issues.
And then, is it normal to feel nervous or embarrassed? Yes, like these are very sensitive and intimate topics that we talk about, and we do, as all of us as clinicians, like work really hard to create a safe and respectful environment for you to speak on these sensitive, intimate topics. And it's a go at your own pace. We're not going to prod and pry. Whatever you would like to share with us at the time of evaluation may be different than after we've gained some trust and get to know each other a little bit better. You maybe feel more comfortable to speak more about the issues that you've been having or new issues or different issues that you've been having, and know that we are a safe place, and patient confidentiality runs across the board, that the things that you share with us are not going to be shared with anybody else. Can I bring someone with me to the session? Yes, if you would like someone to come with you for support, you definitely can. You don't need to, but that's a personal preference for you. Is this the same as doing Kegels? Like Katie had mentioned in the slide previously, not necessarily. Sometimes we actually need to use the reverse instead of contracting and pulling that up and in squeezing kind of method that Kegels are associated with. We actually need to relax and learn how to lengthen the pelvic floor instead of strengthening it. And then we can go into, once we have that down, go into like more of like the pelvic floor contraction, which is typically the term you'll hear us say instead of Kegels. Can this help with sexual dysfunction? Yes, for many people, conditions like vaginismus, painful penetration, erectile dysfunction, and pelvic pain can all benefit for this. So that way, intercourse can be pleasurable again for either party that's going on. And to really alleviate any like strain that might be on a relationship due to any of these that have been mentioned as well. So this is definitely something that can benefit.
And just the last couple here. So number one, is an internal exam required? No, that's actually not mandatory. Usually it can be recommended for just making sure that we can get an accurate understanding of what exactly is going on with the pelvic floor. But a lot of times there's a lot of things that we can do externally through exercises and things like that that can still make a really big difference. And then last one, how soon can I expect to see improvement? It really varies, especially with the pelvic floor. Many people, it's usually within 6 to 12 sessions. Although if this is something that you've had for a longer period of time, it can take a little bit longer just because we are, it's kind of that idea. If you've had this for years, it can take a little while to relearn how do we coordinate that pelvic floor? What does it look like? How do we deal with pain? Things along those lines. So it just kind of depends overall.
So getting into some of the questions that you guys have submitted, the first one would be, what exercises should be avoided or modified if I have prolapse of uterus? And this is a very common PT answer, but it really just depends. That's where we come in, and that's what we do is we assess kind of what's going on, and what exercises are going to be best for you. But in like the grand scheme of things, a big thing that we will work on and kind of teach you is pressure management. So with a prolapse, you have like the sinking down of the uterus down into your vagina. So what we want to do is we want to decrease the amount of pressure that's pushing down, because that's already being pushed down. We don't want to increase pressure on that. So one thing that we'll definitely work with you on is breathing. Breathing's a big part of pelvic health and just what we do. Typically, we'll work on like the big diaphragmatic breathing. So thinking about breathing down into your belly, kind of filling up. And then breathing out with exertion. So that's either you're wrapping your core to use those core muscles, or if we're moving into more functional movements for like a squat, when you're going down, you're going to kind of take that breath in, but as you're coming up and using those muscles, you're going to breathe out so that you can manage that pressure a little bit better. So yeah, not a great answer, but again, it really just depends. But those are a few little tidbits. And then as far as being bored with Kegels, or like Rachel said, the pelvic floor contractions, what other exercises can be done to help prolapse? A lot of things that we'll have you do with a prolapse, depending on your grade, and really how you're presenting, is we again start with some of the breathing. Sometimes we have your feet elevated on something to kind of let gravity help a little bit with the prolapse. And then if we'll get the pelvic floor contractions, but then also we'll start incorporating in some of your other hip muscles, kind of strengthen those areas to kind of give you some stability throughout your whole pelvis.
Some people want to know, like, how do I know if I need to come in for having some pelvic health therapy? Like, is there like some signs and symptoms? I think most people that are having incontinence or, right out pelvic pain, that would be, fairly obvious, but sometimes abnormal bowel or bladder habits isn't quite as obvious, because you may not even know that your habits are abnormal, right? Until they become very problemsome in life. Also, if you're pregnant or postpartum, honestly, the US is trying to catch up, but we are behind other countries. Many European countries, physical therapy is an automatic. We, think about having surgery or having something done to another part of your body. It would just be quite obvious to do rehabilitation or even prehab, like doing some things ahead of time to get ready for whatever your surgery is. But we haven't quite made it there yet. And so, kudos to you guys for starting to kind of think about, like, let's learn a little bit on our own here, because we're starting to have more and more women come in and say, I think I just need a checkup. I just had a baby. And sometimes it's just a few appointments that they can get off to a really good start. And then, yeah, honestly, there's so much to learn about your pelvic health. I think Katie mentioned, sometimes just learning, like, wow, I was today old when I learned that there's a better way to have a bowel movement. Like, I think people on our team who we've done in-services for have been like, wow, okay, I've been doing some of this a little wrong, and I didn't even know that this was normal or this was abnormal. So yeah, if you have a pelvic floor, there's probably something to learn. And that would be everybody, by the way. And then number 4, what should one expect when they come to an appointment in one of our offices, like for that first appointment? So there's usually a check-in process and just some things to fill out. It gives us a really good idea when you fill out the questionnaire, kind of that quick overview, so we can know, like, which direction. This is the relatively complicated area to treat depending on what your symptoms are. And so it helps us know kind of what we're focusing on. But honestly, most of it is just getting to know you, listening to your story, understanding your goals, helping start to look at what that puzzle looks like, and then doing a physical exam. And I think Emma mentioned, like, it doesn't have to include an internal evaluation, and quite oftentimes that first visit doesn't. We really want to get to know you, and so that can all depend on what your goals are and what you want from that visit. But lots and lots and lots of education, trying not to give you over education, but giving you some direction, and helping develop that treatment plan so that you're able to kind of see the light at the end of that tunnel and have a direction to go. And honestly, I think we talked a little bit about Kegels, but what we do is way more than Kegels. In fact, there's a lot of patients I don't have do any Kegels, and really big function based. So I think that's the cool thing about being orthopedic physical therapists first and pelvic health physical therapists along the side of it, is we see the big picture and the whole person. So people that come see us aren't just pelvic floors, they're a whole person, and it's a big task, that we are excited to help people on that journey.
Okay, question 5. I struggle with urgency when going to the bathroom. Any tips and tricks to help with that? So urgency is just the term that we use when you get like that really sudden urge that you have to go to the bathroom. And for some people, that's really strong. Like, oh my gosh, I have to go to the bathroom right now. Otherwise, I'm going to pee my pants. So usually what we teach people right away, which is kind of difficult and kind of counterintuitive, but try to stay calm. That anxiety response sometimes that we have, and that panicking, that trying to run to the bathroom, can actually stimulate your bladder to contract more, and which is going to try to squeeze that urine out even more. So that's kind of first and foremost, like, try to stay calm. We try to get that urge to kind of go from, a level 10 down to like, okay, maybe it's only like a level 4. I can control this. You can do that too by like trying to contract your muscles, like squeeze your legs together, or do like some heel raises that helps contract those muscles. And then we kind of try to, get that under control. Let your brain tell your bladder, like, no, we can wait. I can hold it, calm down, and then calmly go to the bathroom. So those are kind of my big things on the urgency component. And then number 6, I've always been constipated. What does that have to do with my pelvic floor? We've already kind of talked a little bit about some bowel dysfunction issues. But constipation, a lot of people don't even understand what constipated is sometimes. It isn't just, oh, I only go poop, every 5 days or whatever. Some people go poop every single day, but they're still constipated. So really has to do with what your stools look like. So if you have like those really hard pellet type stools, that's, more of that indicator that you're constipated. They're hard to get out. It's hard to push out. Is kind of what we go off of. But yeah, your pelvic floor obviously interacts with your bowels. So, you have to be able to contract your pelvic floor to keep things in. You have to be able to relax your pelvic floor to get things out. And yeah, being constipated, having those really hard stools in there, it just kind of can mess with everything. It can push on your bladder. It can irritate those muscles. Obviously, it's irritating to your bowels. So it can really cause a lot of issues. I always ask about constipation. And if anyone at all tells me that, oh, yeah, sometimes I tell them right away, like, try and do whatever you can to stay on top of that constipation because it just messes with everything. That's especially a big problem in our pediatric clients as well. That's like my first and foremost, if I'm ever working with a kiddo, is to really try and take control of that constipation first. Constipation too will stretch out your bowels and make it harder for your body to sense when you have to go to the bathroom too. So that eventually can start causing issues with like leaking stool and stuff like that too. So definitely important to take control of that constipation.
All right, next question is, I don't have any symptoms postpartum, such as incontinence or pain with intercourse. Would pelvic floor PT still be beneficial? I think we would all say yes, at least for a check over. I mean, birth, no matter how you experience it, C-section, vaginal, all the continuum of things that can happen during those processes is traumatic. You're either having a major abdominal surgery or you're having significant pelvic floor trauma. And either way, you've been carrying around a significant amount of weight for hopefully at least 8 or 9 months. So that pelvic floor has been under a lot of load. So just getting an idea of what's going on, how is your coordination? A lot of people don't even realize they've got a couple little trigger points going on, or maybe a couple of things that they wouldn't consider symptoms are something that we would consider symptoms and something that we can help with kind of on the front end. I think every one of us has treated women later in their lives, whether it's in their third decade or fourth decade or even fifth and sixth decades, for hip stuff or back things or, even upper back and neck pain, that it all boils down to pelvic floor things that likely started after they had their kiddos and just weren't ever addressed. And they didn't really know they were pain or dysfunction necessarily. So I'd say more often than not, when I have women come in postpartum, there are things that we can treat. I maybe one who was just so on top of it during and had PT before and kind of knew what she was, was actually a physical therapist herself. Didn't really need a lot of help, but I think we can, yeah, definitely a population we can serve. It's better to check than to not check, in my opinion. And then what can we do to manage pelvic pain towards the end of pregnancy? This is a stage at the end, especially where we are really focusing on getting that pelvic floor to be able to relax. That's like the most important thing for being able to help baby out. So we work on a lot of things to help get those muscles relaxed, whether that's external massage, hip mobility, teaching perineal preparation, but also like nervous system relaxation techniques, like helping you work on breathing through some of that discomfort, because a lot of times the more stressed or anxious we are, it feeds pain and pain feeds it. So doing everything that we can to kind of bring things down and relax. In addition to, like I said, manual techniques, we've got stretches, a variety of other things that we can do to just get things calmed down a little bit.
Okay, the next question is, pain with sex something I have to expect / get used to? Short answer, no. You do not have to. That's something where, again, like we come in and we assess, is it something where we need to relax the pelvic floor? Do we need to strengthen kind of what's going on? Do hips need to be assessed, back, everything, kind of like all mobility in that pelvic region, or even like back, neck, all the way up and down. It's not something that you have to get used to or expect postpartum or later in life or whenever. If this may occur, this is definitely something we see a lot of, and we kind of teach back into like, okay, how can this be comfortable again? What like steps do I need to take to get back into so like sex is pleasurable and fun again for me and my partner? And there's a whole bunch of different routes. It just kind of depends upon you and your story and where, like, what kind of symptoms that you're having as well. So I think, like me personally, like I think this is something like fun to work with clients on and kind of get back into, and even get not only like you as a client coming in, but like your partner involved as well into this, and to have both of you learning together through this. Um, Question number 10, once I start seeing some progress, how frequently do I need to continue doing the exercises? Kind of depends. But with the initial exercises that we have you start doing, there's always progression of those exercises to be a lot more functional and function based. So once you have the foundation of the coordination and breath and core stability and whatnot, it starts to become like second nature. Your body begins to learn how to do that and adapt to it and put it in day to day. And you may all of a sudden start to notice that, oh, my back doesn't hurt when I'm carrying something, or I don't feel pressure down into my pelvic floor when I pick up a heavy box off the ground or something like that. So your body starts to learn and adapt, and we also adjust and progress and adapt your exercises to you so that way it looks more function based and a lot more fun and a lot more up and moving around. So it just kind of depends. It's not something that you have to do for the rest of your life, but if you start having like issues down the road, you have a base bone of, oh, well, my PT told me this and this is what we started with. Let me try that again and then kind of build again. But then we're also here if things go backwards and things aren't helping and whatnot, so that we can kind of do like, we call them like a tune-up, little maintenance check or whatnot. That's been kind of termed tier 2. So yeah.
So I think just the last two, how long does it take for the pelvic floor to recover after having a baby? As we've been talking about, there's many different things that can happen during delivery, whether it be you have vaginal delivery or cesarean. Each one takes a little bit different. Usually they say on average at least 3 months, but I would say usually longer. It could take anywhere from 3 months to a year, where they even say what is recommended by the CDC is if you do plan on having another baby, waiting at least a year and a half, kind of for pelvic floor rest after having your first or your last baby to get pregnant again. So it can take a while. As we've talked about, there's a lot of things that happen during childbirth. So we just want to make sure that things are well healed after that. And then just the last, I've been told that some bladder leaking is normal with laughter, high impact exercise after having a baby. Is this true? I would say it is something that many people experience, but it does not necessarily have to be the norm. And that's one thing that I think as pelvic floor therapists that we're really trying to take away the stigma of, is that this does not have to be your norm. So those would be the big things that I would say with those.
And I just kind of want to open up the floor to you guys. Make sure we can answer questions that you may have. You have us here. We're happy to help. You can either just speak it out loud to us or put it in the chat. Yeah, so we'll wait around and see if you guys have anything for us. Okay, so it looks like we have a question in the chat saying, my mom is 77 and is having to go to the bathroom very frequently. How can we help her? This is something that we see a lot actually, and we talk about a lot with our clients, and there's a lot of different factors. And one thing that we talk about is like fluid intake. So there are bladder irritants that may be kind of irritating the bladder, and kind of signaling that we need to go to the bathroom. So that's one thing that might be happening. And another thing that we kind of discuss and work with our patients to educate them on is our bladder is kind of like a balloon. So we have different levels that we can kind of hold. And so sometimes we get a signal when it's about this full. And our bladder's like telling our brain, we got to go to the bathroom, got to go now. But really, we have this much space in our bladder. So we can do some retraining kind of the bladder, doing some of the urge suppression techniques, you know, kind of waiting a few minutes, see how things are going in order to kind of see if we can let that urge surpass. But really, it's a step-by-step, person-by-person conversation that we have and kind of see why you might be having that and how we can lead you to decreased frequency in urination.
And just to build on what Courtney said, I often see that population restricting their fluids because they don't want to go to the bathroom. But just like Courtney was talking about, like having really dehydrated, really concentrated yellow urine is really irritating to your bladder. So even though there's not much in there, what is in there is irritating that bladder lining and is telling them that they have to go to the bathroom. And then they go to the bathroom and they barely get anything out. Well, it's because they barely drank anything. So again, it seems kind of counterintuitive, but we really encourage them to be drinking water. Yes, it takes your bladder a while to get used to increasing that water intake, but your body will get used to it. But yeah, that's really important to be staying hydrated.
Looks like there's another question. It's, as a practitioner, what CEUs or resources have you found the most beneficial for pelvic floor treatment, specifically PEDS and pelvic floor waste? So all of us have completed or are on the way to completing various levels of pelvic floor training. Most of us are going through two bodies, either Herman and Wallace or the American Physical Therapy Association. I think in this group, we've got a good mix of both. And so they have different routes, and they teach different things at different levels. Most of it is female pelvic floor biased, and then you can kind of go down some different avenues with male pelvic floor or higher function type courses or PED specific courses. I know Herman Wallace and APTA have PED specific courses as well. There's also, I feel like now is the time to be getting interested in this because there's just all kinds of good, not even APTA and Herman Wallace, but just Institute of Clinical Excellence and all kinds of other groups that are putting really good content out there. There's a lot of collaboration between providers all across the country and the world. So just a lot of resources being put out there for a variety of clients and providers to learn from.
Kind of to go along with that, those base courses are great for kind of understanding all of the basics and that kind of thing. But I think it's really important to also look at it from a broader viewpoint, from a functional viewpoint, just having seen the evolution. So as a practitioner, so therapist to therapist or, you know, whatever, the evolution has been from, you know, isolation, Kegels, like very, very basic to a much broader understanding of function, and the pelvic floor is part of our anticipatory core or our deep core that actually is a basis to turn on. We don't necessarily typically voluntarily turn our pelvic floor on. It's an area that is innervated by our autonomic and our somatic system. Like, so it's a very unique area. And I think if you don't get people off the table and you don't get them moving and working on function and timing and all of those kinds of things, you miss the boat. So in addition to those very basic things, like don't miss out on doing courses that really bring function into that space, and looking down at the foot We don't probably have time. It's kind of beyond the scope probably of what we're doing this evening, but looking at the foot, looking at, like neural tension, looking at lots of different aspects of our bodies, and not stopping at just the pelvic floor. We're influencing the pelvic floor through other avenues as well. So definitely take those base courses. That's really important, but don't stop there.
It looks like we do have another question in the chat. Any suggestions on ways to decrease round ligament pain for pregnant women? So I guess my personal experience with this is it usually comes along with some pretty tight hip flexors and core muscles that aren't functioning well. So usually if we can get those hips to open up a little bit better and get a little more core stability during transfers is when a lot of women feel this, when we're getting out of bed, when we're getting in and out of the car. If we can give you some stability and free up the things that are tight, we take some of the stress off the region that's already been being asked to stretch quite a bit. So there's a lot of different ways we can stretch our hip flexors. That could be kneeling or at the stairs, and the core, even just doing like baby hugs where we're trying to squeeze our deep abdominal muscles to lift baby. Those are great ways to start. Got another question. Are there preventative exercises as we age as women? Like exercise in general is preventative as women. So that's something I personally see in my older clients is maybe they don't have a great movement habit. So just starting a movement habit is really beneficial to our pelvic floor. But part of it is just getting an assessment of where your pelvic floor is at. Are we underactive? Are we overactive? Do we just need help coordinating? Maybe we need some hip and core stability. It's really individualized, and that's the perk of coming to see us for public health PT is we can meet you where you're at and build off of there based on what your why is and what your goals are.
I think the hips and balance are under served for a lot of women as we age. We tend to get a little bit weaker selectively in certain planes of movement. And so unlocking those aspects can be really important. And as we age, just general core, hip, pelvic girdle strength is huge. So, but yeah, I mean, certainly there's aspects that some people are too tight, some people are not strong, and often it's both.
We can certainly keep taking questions. I just was going to throw this slide up here, just our different locations, how to get a hold of us. And also, yeah, we do offer what we call like free screens if you're just like not really sure, like if you need something or if you need to go a different route. So that's kind of what those are. And like we said at the beginning too, always we can check your insurance benefits and all those things to know exactly what is covered, what's not. So
I think one of the perks of that is you can also get a feel for the spaces that we have. And I mean, I think this is a great way to get to know us and kind of what our personalities are like, but we're on a one-on-one basis. We're really here to restore hope. We spend a lot of time educating, and this is just an opportunity. If this is the right fit for you and you feel called to kind of lean into this a little bit, we would love to help you get started on that journey.
okay, well, if there's nothing else, we'll probably end. Unless I missed, nope,
I
someone's
think we
typing.
have somebody typing
Oh,
Oh,
okay.
yeah, very good. And we are going to send a follow-up email. So if you didn't get a chance to like write down phone numbers in whatever area, whatever clinic would be closest to you or whatever, and you missed that, you'll get a chance to do that. You can also go to our website, and you can find each of our profiles under that website with our email addresses. So give you an opportunity to reach out to us if you want to. Otherwise, yeah, be happy to see you in the clinic as well.
Yeah, thank you everybody for attending. And yeah, we'd love to see you in the clinic. So just contact us if you need anything or have questions.
As I responded to someone in the chat, a recording will be available, and feel free to share that with people if you've got friends or family members who you think it would be beneficial for who weren't able to attend today.
Okay. All right. Thank you everybody for joining us.